So firstly, welcome and thank you so much for the opportunity to speak with everyone today. It's a real privilege for me to present, even if we were unable to connect in person. So I'm speaking to you today from Australia. And so we express our gratitude to be on the beautiful lands we all meet virtually on today. I'd also like to take this opportunity and wish to acknowledge the traditional custodians of all the lands from which we come. So today, I'm going to challenge you. So during conferences, we see excellent research presentations covering a broad range of important topics, many using descriptive cross-sectional study design with impressive analysis using descriptive statistics, SPSS software. Conclusions have been drawn and recommendations made. So now you've completed your research project. Congratulations, you've each done yourselves proud. So researchers report their recommendations, but how will then this research knowledge translate into practice? Or will it? Where does it go? I ask you, is it incumbent on each of us to translate relevant research findings into evidence-informed clinical nursing practice? Let's unpack these 3 points. Producers of research, translation of knowledge into clinical practice, and nurses as consumers of research to provide evidence-informed clinical nursing practice. So firstly, producers. There are many more nurses in the front line of healthcare than any other healthcare profession. And as such, nurse-led research is increasingly recognised as a critical pathway to practical and effective ways of improving patient outcomes. Secondly, translating research evidence to clinical practice is essential to safe, effective healthcare provision and meeting the expectations of patients, families and societies. So despite its importance, translating research into clinical practice is challenging. Therefore, the conduct of research should consider how the research findings can influence clinical practice, education, policy or future research. However, there are well-established barriers to the conduct and translation of research evidence into practice. When you look at the conclusion of many research studies, there's a lot of potential suggestions. Should do this, need to do that, we recommend, and less of what's been implemented and evaluated in clinical practice. So where appropriate, how many research project recommendations move to the next step of implementing, evaluating and translating into clinical practice? Sadly, not all. Now this, of course, can be limited by the design and research and the reason for the research. So for example, is the research project designed just to satisfy a curriculum requirement? Controversial statement, I know. Some may even question, how productive is it having students conduct a research project in an undergraduate program? But we do know that research and scientific inquiry help students develop analytical thinking and problem-solving skills. But are we asking students to learn how to do research without then equipping them how to translate these findings into practice? And importantly, to use research findings in their clinical practice. So, understanding the research process helps nurses approach any job with critical thinking skills. If nurses observe a really consistent pattern of a practice, a procedure, a method that helps patients or clients, they can pursue those discoveries and they can either conduct or propose a study on those issues or look for the evidence to support a change in practice. At the heart of dissemination of research findings is knowledge translation. So, my question to you is, when designing research, should you consider how the end user, the nurse or the patient, would use the findings as evidence to inform best practice, such as in practice guidelines or fact sheets, to address evidence practice gaps? So let's go back to producers and designing a research project. So just recapping, nurses and nursing students are likely to be told they've got to do research. They use and apply that research in practice. And while research is being produced at an increasing rate, what we know, the change in clinical practice has lagged. So nurses understand that the clinical care provided to patients, clients, communities should be informed by the best available evidence. And what we do know is nurse-led research that incorporates the principles of knowledge translation in their study design results in improved outcomes. We also know that the success of research implementation in healthcare settings is dependent on nurse or consumer behavioural change. So I'm now going to ask you to challenge the way you might consider doing your next research project. Yes, you'll be doing more research. Translation of findings should be considered in the initial research design and study aims. And implementing evidence by translating knowledge does need planning and strategy. So let's look at an exemplar. I've chosen to use co-design. Co-design is one way of changing the way we look at conducting research and ensure that there's impactful, practical solutions to real-world problems are found. So co-designed research involves connecting with stakeholders, and these can include consumer representatives, those who have the lived experience of an illness, an injury or a circumstance, advocacy groups, non-government organisations, etc. So involving stakeholders provides really valuable, authentic and often unique insights for the researchers that they may have otherwise not considered. Work with people to find or understand the problem and work on a solution collaboratively with cultural sensitivity of the populations you engage. Stakeholder consultation is vital to receive constructive feedback, particularly when working with really sensitive matters, marginalised, vulnerable or diverse populations. We also know communications. They can use a variety of platforms, including social media. So let's challenge the way you design a project. Mix it up, ask yourself, who to involve? The world is moving very much more to consider gender diversity and to be inclusive and more away from a them and us narrative, people doing research on people rather than with people. So let's start to think how research can be conducted in a more collaborative way. So for example, a shift to engaging consumer representatives from the beginning of a research project. They can review the ethics papers. They can review the language you choose to use in surveys, questionnaires or interview guides. So for example, a study conducted in Australia, it involved collaboration with a community group of trauma patients' family members. Now, following consultation, the research aim was broadened to include developing guidelines and aftercare referral and support networks at discharge. And this was aimed to improve the wellbeing for patients who'd suffered major trauma, something that the original researchers had not considered. Another example, clinicians use evidence-informed practice, which is guided by research evaluation and, of course, clinical expertise. The success of research implementation in healthcare is dependent on clinician or consumer behaviour change, and it's vital that implementation strategies include this. So, for example, the research that found women can have different presenting symptoms to men when they have a myocardial infarction. And this requires implementation interventions to translate into this knowledge. So there's a vast array of ways to translate research-based evidence into practice. So in this case, for example, they can include, but not limited to, clinical guidelines, protocols, educational seminars, visual cues such as charts or signs in clinical areas. You would have seen these in your work. So knowing how to use research is important, but evaluating of a change in practice should also be evaluated in terms of outcomes. How well an intervention has been adopted or applied to. So recommendations should inform dissemination activities. So, for example, if you're implementing something in your ward and you say to the people, do you think that the so-called protocol improves patient care? So if most staff do not think that the protocol will deliver improved care, they may not make it a priority to change their behaviour. And so now you know that this is an area that you're going to need to address. So targeted dissemination activities can include summaries for stakeholders, educational sessions with clinicians and/or policymakers, development and implementation of clinical guidelines and media engagement, as we have seen during the current pandemic. So it's well accepted that knowledge translation, or the translation of research into clinical practice, is a process that goes from awareness through to acceptance and finally through to adoption. So while we know there are barriers to evidence-based practice from either clinicians or environmental factors, there are some implementation interventions to translate knowledge. So facilitating factors, they can include systemic approaches, administrative and organisational support, research study guidelines, and of course, educational programs. But in conclusion, I have 3 messages for you to consider. First, when you conduct a research project, I challenge you to think about the end result and how any relevant findings can actually be translated into practice. Secondly, knowledge translation is about ensuring research is informed by the experience and needs of the stakeholders, and stakeholders are aware and use evidence to inform their decision-making and practice. And lastly, evidence-informed practice is the backbone of healthcare, and we as professionals are pivotal in the process. Nursing research is vital to improving healthcare delivery and outcomes. I hope I've challenged some assumptions and presented some effective strategies that each one of us can employ when we conduct, implement and evaluate research, and how best to disseminate and translate research knowledge into clinical practice to improve our patient outcomes. Thank you.